Thank you for attending the effective presentation talk today. I'm Dr. Aiman Smer. I'll be moderating today's session. And before I introduce our speaker and expert panel, I would like to go over a few housekeeping items. The session is being recorded and live streamed on our YouTube channel, so you can review it and share it with your friend to learn from it later on. Please keep your mic muted and camera off so we can all listen quietly and enjoy the presentation. We encourage you to keep your question till the end of the presentation, and one question at a time, please, and also to the topic of the presentation. And at the end of the presentation, I will go over your question with our expert panel and speaker, and we'll try to get as many as we can during the presentation. So now allow me to introduce our expert panel, and starting with no particular order, Dr. Abdelrazak Jhani, consultant interventional cardiologist and chairman of Heart Center in Qatar, Dr. Elkhammas, emerite professor and transplant surgeon at the Ohio State University, and Dr. Ridal Al-Aukali, a cardiac surgeon from Libya. And it's my extreme pleasure and honor to introduce our special guest today, Dr. Scott Litin, from Mayo Clinic, Rochester, Minnesota. Dr. Litin is a general internist and a professor of medicine at Mayo Clinic, Rochester, Minnesota. He's currently spent his time teaching presentation skills as a faculty member in the Mayo Clinic program in professionalism. Last year alone, he facilitated over 100 small group sessions. Dr. Litin has been recognized with countless honor, including Outstanding Faculty Award and Distinguished Educator Award from Mayo Clinic. The American College of Physicians has recognized him as a master of the college. Dr. Litin has organized and participated in vast number of continuing medical education programs for clinicians. In his role, he has heard and critiqued over 1,000 presentations. Dr. Litin has personally delivered hundreds of invited presentations, both nationally and internationally. He has become well-known internationally as a public speaking teacher and coach for medical students, resident faculty, and healthcare professionals. In his own, he described today's discussion of this topic as life-altering. Dr. Litin, thank you so much for joining us today and accepting our invitation. The mic is yours.
All right. Well, I'm very honored to be invited to present to you today. Let me start out and have you all imagine for a moment you have to give a major presentation to the entire Libyan Cardiology Association. And instead of being a little nervous and ill at ease, you were comfortable and confident. You knew you had picked out 3 important points that would be useful to everyone in the audience. You had a really strong opening to get them interested, a wonderful summary, and you only shared 3 important points with wonderful stories, examples, and the like. You spoke slowly and you smiled.
Dr. Litin, we lost you.
Yes, can you hear me now?
Yes.
Okay. Okay. So you're giving this major presentation and you felt confident, comfortable, you spoke slowly, you smiled, you had wonderful body language, passion, and enthusiasm. And after your presentation, the leader of the society came up to you and said they'd never heard a presentation go this well. Well, if we stay together today, that person could be you presenting comfortably in front of a major group. All right. One of the issues, Aiman, is with all the other screen shares and things popped in, my slides do not advance.
The best way, Dr. Litin, is to unshare, stop sharing, and then share again. It will work.
All right, good. We'll try that again. Thank you. Thank you for the advice. Here we go. Let's try it this way then. This is not a good way to start a presentation on how to give a presentation, but I think we'll take it from here. Okay, why is it crucial for all of us to present ourselves and our material in a positive way? Well, it's crucial because we are judged on the way we present ourselves and our material. When we do this well, doors open. We get opportunities in leadership. We get opportunities in teaching. We might even get invited overseas to give a presentation to a large group like yours. So this is crucial for our careers. When you do it well, doors open, but when you don't do it well, they generally find somebody else. Okay, who am I? Why am I doing these? For 40 years, I've practiced general internal medicine at Mayo Clinic in Minnesota. I've always been interested in patient care and education. About 20 years ago, a colleague and I started a workshop to help young doctors get better at their presenting and teaching to help open doors in their careers. This caught on, and pretty soon I have been asked to teach all of our medicine residents, many of our subspecialty trainees like cardiology, groups from all three sites of our Mayo Clinic, anesthesia, surgery, and I'm certainly not the brightest guy at Mayo Clinic. But because there's been a need for this, I've been invited to all these various locations and more to either give a grand rounds or a workshop on this skill set. So the purpose of that 2-slide introductory comment is to give credibility. You all have credibility, but people want to know a little about you and a little about why you're credible on the topic. So how did I get interested in presentation skills in the first place? Well, many, many years ago, see, I haven't changed too much. When I was in high school, I was asked to be the graduation speaker, and it didn't go very well. So I figured it couldn't be me. It must be the audience. They didn't understand my humor or whatever. Well, off I went to university. And while at university, I changed my opinion on many things. I also changed my appearance from entering to graduating. Dr. Smer is interested in obtaining my old shirt and glasses. He thinks it might help him interact better with young people, but I'm keeping them. They may come back in style. While at university, though, I had a chance to listen and watch this next gentleman in action. And I'm sure you all recognize Muhammad Ali. In the 1970s, he was more recognizable than the president in the United States or the Pope, but he barely graduated high school. But he was a fantastic speaker. He could command a crowd. And I figured if he could do this, maybe I could get better. So I took courses. I've certainly written now on the topic. And it's from what I've learned the hard way. I want to share with you a couple of skills today. So what are we going to do? This will be more of a didactic, and you'll have a chance to interact with our expert panel later. I want to talk a little about how to best present yourself, tips for successful presentation. If we have time, we'll talk a little about how to look your best and sound your best in a Zoom meeting. And again, maybe I'll have time to show you a brief workshop example of what we do to help train our young trainees in public speaking. This picture is from the World Cup from a few days ago, but my goals are to get your buy-in, teach you a few tips, but really motivate you to put your presentations together a little differently than you've done for years or maybe heard for years. I'll hopefully be able to demonstrate some of these skills to you. And another important thing, when you're helping other colleagues get better at speaking, you will have better ways to constructively critique and give feedback. So, couple things. Whenever you speak, always include an email address on the handout, on the slide, on the whiteboard. It tells your audience you are approachable. People are afraid to do this because they think they'll get inundated with many emails. Never abused in a professional audience. You rarely get anything, but when you do, it's something good. Maybe a chance to collaborate in a research project, or get a patient consultation, or maybe get invited to speak somewhere else. Write your own introduction. If someone else is going to introduce you, you know your own background and credibility better than they. So if you write your own, 25 seconds or less, a little about yourself and why you're credible, it goes well. We've all been at presentations where the moderator spent more time introducing the speaker than the speaker took for his grand rounds. Nobody cares about all that information. The other thing I learned, the name badge. If you are speaking at a meeting, you don't want to be wearing the name badge, because anything on your person that's distracting will detract from your presentation. When you do wear the badge, it should be on the upper right, so if you bump fists, shake hands, they can read it. But when you are speaking, get rid of the badge. A college professor surveyed 1,000 students about PowerPoint. Many great speakers don't use PowerPoint, but in medicine, it's still the currency. So we are often asked to send our slides in advance, put your slides up on the website of the organization, but they can be annoying as well. A college professor found when he sent a questionnaire to 1,000 students, they could answer more than once what they found annoying. The most annoying was speaker reading verbatim to you off the slides. Another thing is if you've got the text too small, the lettering too small, but if you have 17 lines on a slide, it's got to be tiny to fit. I was taught the rule of 6. Aim for no more than 6 lines, no more than 6 words per line, because we need not have slides typed out in full sentences. Worse yet, paragraphs. Certain colors don't project well on slides. People like blood red, but it's hard to see. You don't have to be colorblind to notice. I only use custom animation appear. Boom, boom. So we're talking about the line when I'm speaking, but only appear. None of these other aggravating fly-ins that don't work. We've never been at a presentation where the speaker said, "Oh, let me apologize for this next complex chart. I know you can't read it, but I had to put it in." Presentations aren't journal clubs. These kind of slides rarely will help you make a point in your presentation. If you feel you must use a graph or something complicated, custom animate where you want the eyes to go, better yet, cut it down, or if it's not relevant, don't use it. Just a couple bad basics. The headers, the size of the lettering should be big in your title. When you read books, it will say the point type, the size of the lettering can be anywhere from 24 to 32. I recommend when you next put slides together, use only 32 point for your letter size. That's 24, that's 28. If you use smaller point, you're going to put more words on your slide. The design of the slide is called the font. I use what's called a sans serif font. Those are block lettering. Serif font has decorative feet and doodads and little projections, harder to read. And beware of what they call the laser or the pointer moth. When the speaker is taking the pointer or laser and it's twirling around on the slide, and then somebody in the back of the room has a seizure, and you feel you may have caused it with that laser pointer or the pointer. Now let's get into some specifics on ways to improve your presentations. Most importantly, when you speak, it's not about you. It's not about how much you know or how much information you want to push at the audience. It's what does the audience want to know or need to know about the topic. When I speak, I figure that the audience is tuned into an FM radio station, WIIFM, which stands for What's in It for Me. When I speak, I know the audience is thinking about three questions. So what? Why would I care? What's in it for me? If you answer that early on, we call that a hook. And if you hook the audience, they'll want to listen and hear more. Here's an example that I want you to pay attention to of a teacher going through a lesson plan with a group of high school students. The teacher is talking about the lesson plan that they want to talk about, but it doesn't meet the needs of the students. So watch the students' expression during this.
In 1930, the Republican-controlled House of Representatives, in an effort to alleviate the effects of the, anyone, the Great Depression, passed the, anyone, a tariff bill, the Hawley-Smoot Tariff Act, which anyone raised or lowered, raised tariffs in an effort to collect more revenue for the federal government. Did it work? Anyone? Anyone know the effects? It did not work, and the United States sank deeper into the Great Depression. Today, we have a similar debate over this. Anyone know what this is, class? Anyone? Anyone? Anyone seen this before?
So you get the picture. When you're speaking about a topic you find interesting, but the audience doesn't want or need to know, you haven't met their needs. The way that you can meet the needs of the audience, whenever you speak, whether it's teaching, research, or administration, is with a three-step approach of organization. If you start your opening with a hook. Now, a hook can either be, if it's a medical topic, start right with a case, or you can start with a story, or you can start with the word imagine. Imagine that you are walking in to see your first patient who complains of stabbing chest pain on and off for the last 24 hours. Immediately, it gets the audience thinking and trying to solve the problem. Then, limited number of teaching points. If your goal is 30 facts in 30 minutes to try to shove in someone's brain, you will fail every time. We don't learn like this. What you want to do is pick out just several important teaching points and modify them with cases or stories. And then don't forget the summary at the end. I like to use the words in summary, because as captivating as this has already been for all of you, you're all daydreaming while I'm speaking. Sometimes I'm daydreaming while I'm speaking. But if you're thinking about something else and suddenly somebody says, in summary, if you only remember 3 things, people start writing them down. Delivery is important. In general, no one presents too slowly. So you want to face your audience. You want to avoid the monotone. You want voice variance. And you can check yourself by filming yourself. Like I mentioned, no one presents too slowly. People are generally very fast, or about right. A pause to a speaker seems very long. A pause to the audience is a brief break. And pausing instead of filler sounds like makes you sound more professional. The only way you can be sure you don't go overtime is to practice out loud with a timer. If you're practicing in your head at night so as not to wake someone, it goes this long, then you get up to speak and it goes this long. We've all been at presentations where the red light blinks, time is up, speaker has 10 more slides, they do this, and you feel, what did I miss? By making your presentation a performance, I don't mean you have to sing, dance, and tell jokes, but you have to connect with the audience. You can do so simply by smiling and facial expressions. If you can't be enthusiastic for your topic, how does anyone else care? Body language, we'll talk about that in a minute. Stories. Stories are what are remembered. Patient stories are remembered. A teaching point tied to a case is 5 times more likely to be remembered than the case alone, or the point alone. Pictures are better than words on your slides. One of the biggest fears of humanity is public speaking. People feel nervous. The beauty is most anxiety doesn't show. They've surveyed speakers and his or her audience. Rate yourself on a scale of 1 to 5. 1 is calm and collected. 5 is shaking and perspiring. Most speakers rate themselves a 4. The audience rates the same speaker a 2. The audience just doesn't want to be bored by your presentation. But if you want to look a little bit less nervous, let's talk about body language for a minute. I'm going to stop the share. Well, it doesn't make me any bigger, so I'll go back to the share for a minute. So if you are presenting live in a lecture,
Dr. Litin,
Yes.
still back on the share. If you stop the share screen so we can see you.
so if I stop, you can see me bigger?
Much better. Yes, very clear. Thank you.
Okay, thank you. My screen didn't show that. But if you're presenting live in a lecture hall and you're waiting for the introduction or the first slide, people don't know what to do with their hands. They often stand like this. This doesn't look very professional. We call this the fig leaf. We call this the firing squad. This doesn't look professional. I tell guys, get the hands out of your pockets. It doesn't look professional. So when you're waiting to be introduced, stand, smile, hands at your sides, because they're making an impression of you. But then when you first are told, okay, Scott, go ahead, you're on. Bring your hands up above the waist in an open posture. An open posture means nothing between you and your audience. This is closed, closed, closed. And the ultimate closed posture, presenting behind the lectern. You've seen TED Talks, I hope. TED Talks and many speakers will speak out in front because body language is so important. You can do this in a lecture hall. You can get a lavalier mic, a microphone over the ear, You can rearrange the computer so you can see the slides. Sometimes you can just move the screen in the lecture hall. Gestures. You can use just regular gestures or purposeful gestures. Do you know they're making pacemakers now the size of a postage stamp? They can get tucked under the clavicle, can't even see them. So you don't need a video to show purposeful gestures. Okay. So we talked about the comfortable posture. Sometimes your voice gets a little dry. You're nervous and you don't have much saliva. So it's okay to have a little water, tea to sip on during your presentation. Probably not a carbonated beverage. Sometimes the bubbles come up in an inopportune time. Eye contact. If you're nervous, you want to make eye contact with somebody in the audience who's smiling, affirming, giving you confidence. And then look around and make eye contact with others. Humor is very regional. Different countries, different parts of countries. So if you are going to use humor, the most appropriate humor you can make is self-deprecating. I didn't do well at graduation. I had that funny outfit on when I graduated from college. I have made mistakes, and it's what I've learned the hard way I want to share with you. When you point it back at yourself, you sound much nicer. If you point at others, it's kind of upsetting. So, in summary, if you only remember 3 things about the presentation of yourself, you want to be organized. You want to start with a hook, a case, a story, the word imagine. You want to make this presentation a performance. Enthusiasm, smile, facial expressions, gestures, stories. And here's a bottom line. You will be remembered longer for your presentation skill than for what you present. Unfortunately, people don't remember a lot of factual information, but they remember you. I'm going to prove it to you. Think for a moment of a great speaker who you have heard in the last 2 years, let's say. Somebody so good, if they were presenting on your campus next week, you might skip a meal to go listen to them again. So I'm going to give you a moment to picture somebody like that in your mind. And then I'll ask you the following question. How many facts do you recall the last time that speaker presented? I often know what the answer is, but you remember the person. They were either in command of the knowledge base. They were friendly and approachable. You knew you could call on them for help. You could send them a patient. They were funny. They made you laugh. They were wonderful storytellers. They were so passionate about the topic you wanted to read more. But we don't remember all the stuff. We remember the person. But colleagues, if you can leave people with the impression that you're very knowledgeable on the topic, that you're friendly and approachable, they can call on you, and they'd love to hear you speak again, that's really not a bad impression to leave with an audience. So let me just change gears for a moment, and let's talk about presenting in this kind of a format, in a Zoom meeting. Like it or not, if the pandemic ever fully ends, 3 things are going to be with us. People working from home, doing video visits with patients, and interacting in Zoom meetings. Now, I want to share with you 6 tips that will help make you more effective and look better and sound better during a Zoom meeting. Let's start out with appearance, lighting, and background. And to do this, I want to share a screen with you of an education meeting I was in a society to which I belong. Now, for appearance, I want you to remember you want to be centered in the screen with some torso available so you can do some gesturing. So let's look at the screen share. This gentleman in the middle of the screen is not presenting a good look. His head is half in, half out, hand over the mouth, not the way you want to present yourself. The woman in the upper right portion has all the light coming in behind her. It blurs her face. So you want the light in front of you or on top of you, not all behind you. And this gentleman in the purple shirt has 40 pictures on the wall, a cabinet that looked like it could fall, possibly giving him a closed head injury. Not what you want. So a lot of people will use a blur screen or an appropriate green screen background, but you don't want to be too familiar with a moon or a park. You want to be more professional. So these types of green screens aren't the best. So we've closed the chapter on appearance, lighting, and background. Now let's open up and talk a little bit more about the perspective of the camera, which should be eye level, and looking into the camera as much as possible. So perspective, if it's too low, it's looking up your face. It looks like you're getting an ENT exam or a COVID test. If you aren't looking into the aperture of your camera, it looks like you're disconnected, maybe doing email or the like. So let's look at our group again. These people, these 2 fellows have the camera too low. We're looking up their face. These 2 people are not looking toward the camera, so it looks like they're disconnected, maybe doing email. And I figure all these people down here, they're probably in the other room preparing a meal. But if their camera is off during a meeting where you're supposed to be participating, it doesn't make it appear to the rest of the group that they're playing an important part. Now, there are going to be times that during a meeting, you have to check an important message on your phone or pager, but you don't want to get caught like this screenshot of a news show where the woman in the upper left of your screen is looking at her email on camera. If you look at the other participants, they're staring into the aperture of the camera. It looks like they're looking deep into our soul. Very impactful. Finally, sound. Sound can be the Achilles heel. Sound can be the Achilles heel. So you want to do a sound check before your meeting. And if it doesn't work in any other way, you might want to wear one of these devices with an earphone and a microphone. But you have to be aware that this could be a little distracting, make you look like a coach or an airplane pilot. So if you don't need it, don't use it. So in summary, we've spoken about 6 tips for success in a Zoom meeting. Appearance, centered, some torso available. Lighting in front or on top of you. Background, not overwhelming or use an appropriate green screen. Perspective at eye level. Looking into the camera as much as possible and doing a sound check. So at this point, let me once again summarize the take-home points. Organize your presentation. Start with a hook, a story, a case, the word imagine. Limited number of facts and a strong summary. Make it a performance. Smile, hand gestures, good body language, passion, enthusiasm. Share stories. The bottom line is you will be remembered for the way you present, which can open doors for your careers longer than what you present. And with that, I think we can stop here and give it back to Dr. Smer, who will be able to coordinate the question and answer among the moderators.
Thank